diagnosis. That was up from 8% in 2007. Then came the COVID-19 pandemic with its traumas and social isolation. In its first 2 years, symptoms of anxiety and depression worldwide reportedly doubled. In one survey, 46% of U.S. parents said they'd noticed that their children's mental health had worsened. Mental health care professionals who treat young people reported a huge increase in demand. One psychiatrist called it an avalanche of severely depressed and anxious youth. Leading U.S. health groups have been sounding alarms. As of this writing, the American Academy of Pediatrics, the American Academy of Child and Adolescent Psychiatry, and the Children's Hospital Association have all declared a national emergency in youth mental health. These trends highlight a major reason why your job as a parent today is, frankly, harder than it has ever been. If your child is seriously depressed, the work may demand quite a lot of your time, money, if you have it, attention, smarts, and networking skills. Our intent with this book is to help ease that burden, supporting you so that you and your adolescent can thrive. As many a parent can tell you, your work can't start too soon. I wish I'd recognized depression for what it was, says Carol, a mother and fundraiser for a nonprofit organization. It's so easy to mistake it for social awkwardness or just being a loner. When my son was in high school, he started staying in his room a lot, with his door closed. I thought he was just studying hard. By the time I truly understood the problem, he had turned 18, and I didn't have as much influence. Life between the extremes. Like most physical illnesses, mental illness occurs on a continuum. On one end lies optimum mental health, allowing people to process thoughts and feelings in a way that help them succeed in school or at work, have fulfilling relationships with other people, and cope with change and adversity. On the other end lies illness, diminishing the capacity to function in any of these spheres. Most of us live near the healthy end of these two poles, with good days and bad days. Your task will be to help your child move closer to that healthier side, with many more good days than bad ones. There is no magic formula. No book can substitute for individual professional diagnosis and treatment. If you suspect your child is more than ordinarily moody, we urge you to have him or her evaluated by a qualified mental health professional as soon as possible. Still, it's worth understanding that no matter how much you're willing and able to work and pay, there is no such thing as magic. No fast-acting, surefire pill or therapeutic technique to treat a mood disorder. Nor is it certain that you'll find a Dr. Right to lead you and your child swiftly out of distress. Helping to lift a child's mood can take time, and you are dealing with a medical system that, by many accounts, is broken. Parents often feel frustrated as they absorb just how different psychiatry is from orthopedics or cardiovascular surgery. While mental illnesses often have physical symptoms, there is much more variation, subjectivity, and often controversy surrounding approaches to address them. Mental health treatments are often more complex and multi-layered than setting a bone or repairing a leaky valve, involving learned habits, environments, and thinking styles. To give your child the best chance of success, you'll need to educate yourself. A basic understanding of diagnoses and treatments will help you choose a specialist, know the right questions to ask, and understand the advice you get. Without wishing to scare you, we do want to emphasize the high stakes. Depressed adolescents are considerably more likely than others to intentionally injure themselves, including attempting suicide, a risk that has been tragically increasing. In recent years, suicide has become the second leading cause of death for this age group. The U.S. suicide rate for those aged 10 to 24 rose by more than 57% from 2007 to 2018, up to nearly 11 youth per 100,000. And that was before COVID-19. Knowledge is power. The news may be grim, but remember, depression is a treatable illness. In the following sections, we'll empower you with lots of practical